Homeless and Diet: Navigating the Intersections of Homelessness, Nutrition, and Healthcare Practices by Nicholas Crua, Jeanette Pisano-Segura, Lance Walter, and Brianna Yanatani. Homelessness: A population of individuals who have no home or permanent place of residence, also known as the unhoused. This diverse culture of people are not categorized solely based on their genetics, geographical location, or spiritual beliefs, but rather known for their lack of stability when it comes to shelter. These individuals are all faced with different forms of adversity, but they all share the same challenges of having an adequate nutritional diet that supports a healthy lifestyle. Diet is a daily struggle for these individuals. Many are unsure where their next meal may come from, which leaves them with an overwhelming uncertainty about when they will enjoy their next meal. While some may engage in panhandling, theft, or foraging in order to find their next meal, others may acquire their meals from private donations, food banks, or government assistance programs.
Now we have a little bit of knowledge regarding homelessness and their usual diet. Let's talk about the impact of their diet in this community. Homeless individuals face food scarcity and typically have inadequate intake of essential nutrients. Due to lack of essential nutrients and nutrition, this can lead to these individuals developing many health issues, such as a weakened immune system, they're more prone to infections, delayed wound healing, chronic fatigue, dehydration, and even mental health issues. You can imagine that the list goes on. Those who have pre-existing conditions such as diabetes, hypertension, and heart disease are at a much higher risk of experiencing a medical emergency due to inadequate nutrition. They can experience things such as a stroke, heart disease, and diabetic ketoacidosis. According to studies, homeless individuals have a negative relationship and opinion on the healthcare system. This can prevent them from seeking medical attention and care, even when it's promptly needed. That's question number 1. You are treating a homeless patient who believes that his food has been poisoned. What techniques will you use to encourage your patient to eat? A. Asking open-ended questions and provide therapeutic listening. B. Sharing personal preferences regarding diet. C. Documenting reasons why the client does not want to eat. Or D. Offering resources and providing education on the importance of adequate nutrition. And the answer to NCLEX question number 1 is D. Offering resources and providing education on the importance of adequate nutrition. The rationale behind it is that offering resources and providing patient education is patient-centered and addressing patients' needs first, Maslow's hierarchy of needs. Educating the patient after providing resources empowers the patient to make autonomous decisions regarding their own health.
NCLEX question number 2. A homeless individual is admitted into the emergency department with signs and symptoms of hypoglycemia. Which of the following nursing interventions will be most effective in treating the patient's hypoglycemia? A. Provide preventative education regarding blood sugar. B. Administer insulin according to the sliding scale. C. Give 15 grams of fast-acting carbs every 15 minutes. D. Wash hands. The answer is C. Give 15 grams of fast-acting carbs every 15 minutes. Per the American Diabetes Association, following the 15-15 rule is a simple and effective way of raising a conscious patient's blood sugar. 15 grams of carbs are given every 15 minutes until the blood sugar reaches the normal range. An example would be something like hard candies. Providing education wouldn't help in that moment, but it would be useful in the future. You also don't want to give insulin if the patient's blood sugar is already low to prevent a hypoglycemic crisis. Lastly, washing your hands is great, but it will not help your patient's blood sugar in that moment. Moving on to nursing diagnosis number 1, a homeless patient may be at risk for chronic constipation related to inadequate dietary intake. The patient may not be able to consume a balanced diet and may result in constipation. Some SMART goals that we set are patient will have a normal bowel movement once a day, and patient will name 3 foods high in fiber after a teaching session. Our interventions include auscultating the abdomen for bowel sounds and educating the patient on healthy food choices that are rich in fiber.
Nursing diagnosis number 2. Risk for deficient fluid volume related to insufficient fluid intake. The SMART goals are to maintain fluid volume at a functional level as evidenced by individually adequate urinary output with normal specific gravity. Then demonstrate behaviors or lifestyle changes to prevent development of fluid volume deficit. The interventions are to note possible conditions or processes that may lead to deficits in fluid loss, and then engage client, family, and all caregivers in a fluid management plan. The third nursing diagnosis is imbalanced nutrition, less than body requirements related to inadequate food supply. The SMART goals are to demonstrate progressive 1 pound weight gain per week toward goal and display normalization of lab values. The interventions are to refer to social services or other community resources for possible assistance with clients' limitations in buying and preparing foods. And then the second is to assess dietary needs and prepare I&O daily checks. In summary, despite political efforts, homelessness continues to be a surging crisis in the United States. According to the National Low-Income Housing Coalition, over 700,000 people were homeless in 2024, which includes children and an array of ethnic diversity. This insufficient financial stability leads to a large majority of malnourished men, women, and children that find themselves in emergency departments nationwide without health insurance and resources.